Today's topic is on maximizing clinical documentation. So, welcome to the session. I'm Amy Ostrem, our Vice President of Skilled Nursing Solutions Strategy here at MatrixCare. And I've been working with MatrixCare for over 23 years now. And like all of you, I just have an extreme passion for the industry and, of course, everything that all of you are doing here as we continue to navigate the pandemic of COVID. So, let's get started. We know that your time is valuable, and wherever you can save time and spend more time with residents is a huge win. Whether you're a nurse on the floor, the director of nursing preparing for stand up morning meetings, or a regional manager, the Matrix Care dashboard saves you time by providing real time information that's relevant to you. Over 50 dashboard items are configured and ready to be enabled based on user roles in your organization. Information is presented that maximizes the speed of notifications, that guides clinical excellence, and improves outcomes, such as presenting vitals out of range and scheduled clinical documentation that is due. Also, recent events such as a fever and MedPass progress, including due and late administrations, and much more. Caregivers commonly use the dashboard to help them prioritize their day with automated alerts, notifications, and automatically generated to do items. From these dashboard items, users can instantly navigate to the resident and the area that has been brought to their attention to learn more about the situation and take immediate action. The Matrix Care dashboard not only saves time, but it helps you significantly improve workflow and compliance. The Matrix Care wound management solution plays a critical role in overall clinical documentation, and it was significantly enhanced over the last year. It includes an interactive body so that wounds can be identified in any location. Included in wound management are focused assessments based on the wound type. The wound management solution provides one easy to use area to identify, manage, and track the healing of wounds. It also provides a visibility into better tracking and trending of overall wounds over time. This area of wound management provides a single resident overview indicating the number, locations, and types of wounds for a resident. This main page acts as a home page area for everything related to that single resident's wounds in a one-stop shop right within Matrix Care. If you have not fully implemented the wound management solution in Matrix Care, now is a great time to take a peek at this area. 800 facilities and more are utilizing these wound management features today. And of those, we do have clients who are no longer paying for an additional wound management software, and they're finding value not only in the new enhancements that we've provided, but also in having wound management fully integrated into the Matrix Care electronic health record. And also having so many wound types and documentation or observation questions already defined for each of the wound types. And that makes implementing this area easy. It's instantly brought value to our customers. Another important piece of clinical documentation is progress notes. And this was another recent update within the last year. And it was introduced to provide fully customizable progress note templates. We found that some of our customers were formulating their notes in a separate application, such as a templated Word document, and copying that information into MatrixCare. So now you can define and create progress note templates right in MatrixCare to simplify and guide charting for focused topics. For example, neurological checks or respiratory notes. The templates offer standard questions and answers as applicable to save significant time and standardize care even further. The shift from documenting free text notes to selecting answers and minimizing the need for long narratives and typing will be a welcome change for your entire interdisciplinary staff. And this is an example of the area where you can go into add a progress note and choose the template that you would like to work on. Resident documents is a way to incorporate outside and any additional documents in the resident's electronic chart, whether it's paper you would like scanned in or an electronic file that needs to be associated with a particular resident's chart. We handle it all in MatrixCare. There are supporting APIs or integration tools to even automate the importing of external resident documents from other systems. Resident documents are organized into categories that you define. So you might see a category for admission forms, insurance cards, and even therapy. It's common that MatrixCare customers import their therapy documentation, such as evaluations, on a daily basis to make it available to the entire interdisciplinary team in MatrixCare. Now, in addition to wound management, progress note templates, and resident documents, we also have to mention that MatrixCare offers a full library of standard of care forms. There are over 200 forms incorporating evidence-based best practices to choose from. Many also incorporate MDS questions, which will assist you in completing your MDSs even faster and more efficiently. You can choose to use the MatrixCare forms, you can tweak them, or you can completely build your own. This flexibility allows you to easily build in your own standards for clinical excellence and to take action if you need to update your forms based on industry trends, a public health emergency such as COVID, or based on guidance from your medical director or clinical experts. In addition, the forms can be scheduled and they will automatically tie into your dashboard in MatrixCare to ensure further ease of use for your caregivers and advanced clinical oversight to ensure completion in a timely manner. The schedule of forms that are overdue, due, and will soon be due is available on the MatrixCare dashboard. Event tracking forms in MatrixCare help to document clinical events. So a good example of this is a type of infection. And our infection tracking in MatrixCare is driven by events. And we've defined this infection tracker tool that you're seeing to consolidate resident information around infections and orders, so different medication orders such as antibiotics, which is highly valuable to folks like your infection preventionists. So from this infection tracking area, analysis can be performed with various filters and statistics, and the data here can even be exported to Excel for further analysis. The time saver with this is significant, especially for infection preventionists that we've found building their own spreadsheets from scratch, or those who are using an external infection tracking system and end up doing duplicate data entry. So if you haven't explored the workflows that you're utilizing for infection tracking in a while, now is the time. MatrixCare could be able to provide you a significant time savings with a very easy plan of implementing for this feature. And the infection tracker is excellent for that detailed analysis within a facility in different areas. But we also have to show you this area. This is our corporate-wide infection tracking analytics tool that instantly brings all of those statistics to a whole new level. Infection statistics and trends automatically consolidate here from across your entire organization and come together in this user-friendly view that you can easily drill down into. My Analytics is a solution that automatically pulls data from a variety of areas in MatrixCare and presents analysis to you that you can further isolate in a number of different ways. Information displayed also provides you with trending data at a glance, so you can easily monitor the trend with acute upper respiratory infections or monitor the results of your recent education efforts and process changes for maybe UTIs or urinary tract infections. The infection information provided in My Analytics is ideal to use for your quality assurance program. And as another example, you can easily isolate and analyze infections that the residents were admitted with versus infections that were acquired within a facility. And with that, I'd like to thank you for joining us today to learn more about maximizing your clinical documentation.